Thanks so much. It's great. This morning, following Congressman McDermott, I got a kick out of it because I think it was supposed to go 2-3 minutes. When you invite politicians, they come when they come and they talk as long as they want to talk. So that's what happens. I once had a mayor who came to our convention. He was supposed to go a half hour. He showed up exactly on time, spoke for 3 minutes, messed up my entire schedule. Anyway, so yeah, I'm the president of the International Federation of Professional Technical Engineers. I also am very proud to be the chair of the Labor Caucus for Single Payer. The Labor Caucus for Single Payer currently boasts membership of about 500 central labor bodies throughout the United States. 48 state labor federations are members and have endorsed single payer as the prospective solution to our healthcare problem. 18 national unions, not all but most belonging to the AFL-CIO, are currently in the Labor Caucus for Single Payer, and we're growing. And the reason for that, and the reason for all these central labor bodies belonging and endorsing single payer, is because the rank and file members, the people that really run the labor movement, it isn't us smarty pants in Washington, D.C., it's real women and men working out in the real world who really drive the labor movement. And they have seen to it that their national unions, that their state labor feds, that their central labor councils continuously reaffirm their commitment towards single payer. Because these individual women and men bargain collectively with their employer over medical, vision, and dental insurance plans. They've been doing it for a long time. And they have seen more and more that employers are just driving down their own investment into their workforce, so employees get hit with higher and higher co-pays, out-of-pocket expenses for plans that cover less and less. Working men and women rank and filers have heard endless horror stories from their co-workers, from members, from their neighbors, about people who once thought they had adequate amount of insurance, and then find that their physician's directive toward care, towards treatment, is being overridden by some insurance administrator who's trying to police an inadequate policy. Working men and women, union rank and file people, have seen retirees who have been forced into bankruptcy because they can't afford to pay their own out-of-pocket expenses, as employers more and more simply abandon retiree medical. Most of you may not know this, but under the law, under current U.S. law, retirees are not counted as employees. I don't care if you were a union member your entire life, you were a 40-year Teamster. Once you retire, you are not an employee according to the Act, according to any laws in the United States. And unions do not have the strength, the power, the legal standing to bargain for retirees. So if employers simply say, we're no longer covering retirees under our medical plan, there isn't a whole hell of a lot the union can do about it. You can't strike over it. It's a permissive subject for bargaining, but if the employer says we're not bargaining over it, then they just won't. So, don't know if anyone knew that. Beyond that, beyond the current conditions and the escalating conditions, and yeah, I'll also take a little bit of exception with what Congressman McDermott had to say, union members are now are horrified to see that many of these plans that they have negotiated with employers, they've worked with employers to create plans, that somehow address in some way the needs of the members, the needs of the workforce. And workers have given up wages, they've given up pension benefits, they've given up employment opportunities in order to create a better health care plan for their members. And in exchange for that, they've seen these, what can only be viewed as morally responsible insurance plans labeled Cadillac plans, not just by laborers' detractors, but by laborers' allies. That's what we're facing. And the reason for all of this, of course, is because the American healthcare system is being driven by insurance companies, whose only, and it is, I mean, if you look at it, what is an insurance corporation, a multi-million dollar corporation? Their job, The job of the people running that corporation is to return profits to the shareholders. That, they must do that. That's under the law. So in order to do that, in order to maximize profits, they have to deny care where and when they can. That's what happens. That's why the labor movement, for all of these reasons, that's why the labor movement is dedicated more than ever to the prospect of national single payer, of health care for all. That we've got to have that as the national policy in this country. So we understand, like all Americans, we in labor understand quite well the notion of progress. We know the difference between forward and backward. We scoff at a political party whose only interest is rolling back the Affordable Care Act with nothing to replace it, with no solutions, except to say, we're going to get rid of something that they've named after the president. By the way, think about that for a minute. What laws in this country are named after Roosevelt, are named after Johnson, are named after Reagan, are named after anybody named Bush? They just picked this one out and said, we're going to name it after this guy. You know, like, we don't do that with any other laws. They just picked that one out and did it with him. In any event, that's their problem. We go beyond that, looking at the Affordable Care Act. We in labor really got to shake our heads in exasperation at the fallacy of a law that only seeks to provide irresponsible and inadequate insurance plans to working men and women. People don't need insurance. They need health care. They need medical care. We've seen what happens. We've seen what happens. We've seen, and I've heard from, patients, cancer patients, whose doctors prescribe treatment, and the insurance company says we're not paying for all of that. I've seen veterans who are trying to leave the service, who want, they put in their time. They put in 6, 8, 10 years, and they think maybe they'll go get a job, in the private sector or in the public sector. But if they leave the military, their first concern is, how am I going to provide for medical care for my family? So they have to find some company where maybe they're lucky enough to find somebody, to find employment where somebody provides some level of insurance. They need medical care, the same medical care they got while they were in the military. That's how we really are going to honor our veterans, by making sure that we've got national health care, that we've got single pay. So we in the labor movement stand strongly, as strong as ever, in favor of national health care, in favor of single payer, because we believe, as strong as ever, and our resolve will not weaken, that every man, woman, and child is entitled, because not by their wealth, not by their financial status, not because they're lucky enough where the dad or the mom happens to work at the right place, but by their medical needs. Every man, woman, and child should receive the medical care and treatment that they need. It should be the right of every American citizen, and we in labor will not rest until that day happens. Thank you.